Right. So, welcome everyone for this 26th webinar. We are doing a series of webinars using all the methods. We are trying to incorporate basics. We are showing that basics we are not leaving in any of the cases, although we are using all the methods, but we are sticking to the basics. So today also we'll be doing this case, and we are doing plant series. So we'll be doing 30 cases of plants in this series, and today we are doing the 26th one. So I thank you all for being with me in this journey. Your enthusiasm, it helps me also to go further and make it more interesting for you all and make it more innovative. So this is Basics of Homeopathy, webinar 26 by Dr. Meeta Nihlani. And today's agenda, or today the reason for picking up this case is this case was with many homeopaths, and it was referred to me after a long time. Like, she was having this complaint of allergic rhinitis since long. So when a person comes from well-known homeopaths, or that they have done well and they have tried their best, so sometimes it also gives us a clue that this is a remedy which we don't know. This is here to teach us something new. So this always excites us, and it also adds to our knowledge, working with these cases. So this remedy we'll try to learn from various aspects. So this is a case of allergic rhinitis. She starts getting frequent sneezings. She says, suddenly when I'm there, this sneezing starts, and she says, I don't know what exactly the trigger is, and she has been working since many years to come out of this problem. She says that my nose feels very stuffy, and with this stuffiness there is headaches also. She says, I get this headaches over here, means her sinuses are also affected, and there are headaches with this coryza, and this head becomes so heavy that she is not able to work, and her work is important for her. Sometimes the headache also becomes very severe. She says that it's as severe as migraine, I feel. So sometimes doctors have given her anti-migraine pills also. So although she says that I know it's coming from the coryza thing, but I try those remedies also sometimes, which give her relief. She mentioned of leukorrhea, but I was not able to get any peculiarity out of that leukorrhea, which was obviously better when this remedy was given. So, because as such, we didn't get any triggers, we didn't get any modalities. That is very important, in a case, if we get clear cut modalities, like we were discussing before the start of this lecture also, if we get a clear cut modality, then we are able to find out some remedies. But there are cases where we don't get any modalities. So we have to go deeper, because as you see, it's all the generals are there, that there are frequent sneezings, the nose is stuffy, headache with coryza, and sometimes the headache becomes very severe, which appears like migraine. So this was the pathology in the case. So although we take this as rubrics also, but there is something more to be taken so that we can come to the remedy very clear cut. We can come to the remedy very confidently. So as this patient was staying away from my city, around 60 kilometers away she had come, we always try to give full justice to the case, because they have to travel 60 kilometers to my place, to reach to my place, and it's a whole lot of journey. So I try to take a complete case taking with all her life space, and from where she is coming, what is the uh, evolution of her, what is the issues with her, where she's stuck in life, what are the lessons she has to learn, from where she's coming. All this I take incorporate in my case taking. So this is a case of allergic rhinitis in a lady who is 32 years old, and she is a teacher. When I asked her who you are, we have to see that who this person is. More than the pathology, I try to understand who this person is. So this is a person who is a teacher. She also takes care of her family very, very, very positively, or you can say she's wholeheartedly involved in her family, because this case was referred to her by her husband. The husband was taking treatment from me for IBS. So the way he talked about her wife, his wife, was also something very peculiar, which stayed in my mind while I was taking this case, which I'll share shortly. So this lady, she stays with her parents for a job, her husband's house in a distant village, and they have a job in some distant other village where she stays with her husband. So her husband, her child, and she, they are staying at a parental home because their job is in that village. So now we see a lady who is staying with her parents, and with her family, and she's also doing a job. So what happens is, like, and the husband is suffering from IBS. So husband, the way when he was giving his history, he says, I get very angry when she doesn't take care of me properly. She has to do everything at home. Like, she packs her tiffin, she makes everything, and she goes to office, to the workplace, which is same as a husband who, the husband himself is not able to cope up with that job part, but he is expecting this lady to do the job as well as take care of him. So we see these expectations of the husband. She has to take care of me at all levels, this because I'm suffering from IBS, so I have to have my meals properly, time to time. So this was the husband's expectations, and which were fulfilled by this lady. So just imagine two teachers, they have the same set of responsibilities, same set of work culture, and the work culture with the husband was so stressed up that he was suffering from IBS because it's a government job. Ma'am, we don't get vacation holidays. If I have to come to you, I have to, plan for so many days and then I can come to you. Then we have some training sessions, they don't allow us to keep free. If we have a holiday, then we have this election duty and all. So this man himself, he was grudging about the job, but he was not realizing that this same problems are being faced by his wife also. At the same time, he was adding so much impositions on her for his care and like housekeeping, his care, his nutrition, the care of his son. So what we see, a person who is taking care of everything at this level. So this interpersonal relationship, this family dynamics is also important when considering the remedy. So on holidays, she goes to her in-laws place, which is one, she has in-laws place which is distant in the village where the parents are staying, and there is another brother, the brother-in-law, the brother of the husband, who is staying in a uh, city. So during this vacations, during this Corona time, she went there. The family, the family of three went there because it was Corona. So they wanted to be in a city where they can get this medical facility and all, right? So here the allergic attacks were more. She says, otherwise I used to get them off and on, but because she's staying with her sister-in-law, these allergic attacks have increased. So now what clue she is giving? We did not get any modality at the physical level. So now she is giving us one trigger point, or she is giving us where these problems have triggered. So this we can use as the conflict, the triggers of the conflict, right? So we can use this information in our practice, in our remedy analysis, so that we get closer to the remedy, the similimum. So the allergic attacks were more when she was with her sister-in-law. So now we try to understand what is happening here, what is the dynamics here. So here the dynamics was that she has to work there a lot. She says, I have to work. I'm staying at my sister-in-law's place. We are in this city now. We are in this house of the brother, and it is a so-called joint family. The brothers are very much connected. So she says here, my sister-in-law does not do anything. On the contrary, we are staying here as guests or for some time. On the contrary, I have to do everything for her and her family. So it was not like, they working together. It was as if the whole brunt was on this lady. So she says, I don't take rest. I want everything to be in peace. I'm very scared. I don't want any quarrels. I want a peace. We have come here. So I want that family bonding over here. So we can see this timidity of the lady, that I don't ever say, I don't ever tell her to help me. I can manage. I do everything on my own. So what we are seeing is, again, we are confirming the capacity for her housekeeping and the work she can do. So we can see her capacity to work, the way we saw it at her own place, that she was working outside also. She was a teacher. She was doing justice to that work, as well as she was taking care of her husband, who wanted everything to be done in a precise manner. So we see a person who is able to take care of many things, and also we see the timidity. Now we see ki what is making her this timid. Why is she so timid that she's doing everything at the sister's place? She says, sister-in-law's place. She said, I get very tired. It is the work whole day. It's around the clock work. I don't get rest. And this is my holidays. We are preferring to be here in holidays, with because corona time, there was no work. Actually, there were no college. This was a time when there was no online classes also. It was the very beginning of the corona period. She says, I get tired whole day. I'm working, but I don't speak a work. I just manage to do my things. And she says कि मेरे को अब यहीं पे रहना पड़ेगा, तो I have to maintain that peace. She says, I asked her ki, what is that peace, or what is she getting over here, why she is staying here. She could have stayed at her own place. She was staying at the parental place also. She says ki, I want this family to be together. She says ki, these brothers are so happy together. There is a beautiful bond these brothers are sharing. So she says, I don't want this family thing to get affected just because of the work thing. ये छोटी छोटी जो काम की बातें होती है, she says, I can manage. I just want this family to be happy. I want these brothers to be happy and in peace. Also, she says कि this is one more home my kids can come to. So she says कि मेरे बच्चों के लिए एक और घर है, तो I want this home, these doors of this home to be open for my children. My kids are happy here. So she wants this happy place, and you can see how a home is a happy place for her. She wants the kids to have a family in vacations. They have so much fun together. So this is the reason she bears everything. She says, my sister-in-law is very harsh, and that is something which affects me day in and day out, but I try to neglect it and try to bear it. So what we see here as a person, what you're able to understand, this was the only information I had, and this is how I came to the remedy. I worked with the remedy. I'll show step by step how I came to the remedy. But meanwhile, you all can share in the chat what you're thinking, on what lines you're thinking, so that we know, like we are together, or how to move together in this case. So any clues? Yes, she wants harmony, right? Anyone else wants to share? Lakshmi, sacrifice for the family, timid care for the family, yes. Lakshmi, are you there? Self-denial, yes. Yes, the family is important. So, as we know,
recording in progress.
So where do we put this patient in? I've shared some of the subclasses with you all. We know that we are working on plants. The way we are working, we had worked on minerals in periodic table. So we are trying to form a periodic table of plants, a table of plants, not exactly periodic table, but on the same lines. So anybody else, other than this, whatever you have put, anybody can think of some remedy? We can think of pulsatilla here, right? I think this is what we can know. If we don't have the map, or if we don't think of new remedies, we can think of pulsatilla here, right? Thuja. Reasons for Thuja? Why the reasons?
मैम as she is very timid and just like उसको थोड़ा मेरे को sensitive लगा कि भाई साथ में रहना चाहिए. There is fragility in her behavior somewhere.
Okay, right. Madhuri. So let's see how I came to the remedy. Family is important in subclass 4, right? So let's first see how we'll move in this case, how I work this case. So sometimes what we do is we repertorize and then confirm with the knowledge we are building on the system method. Sometimes we come from the system method and then we come to a set of remedies, and if we know it's a plant, if it's animal, then we work out, go for the repertorization and then pick up the like if we know it's an insect, then on repertorization we pick up the insect remedy. So we can go vice versa, either here to here, or ultimately it's about a peculiarity and coming to the totality. So in this case, I just worked out what was conspicuous in this case, the pathology. Although these were the symptoms which I picked up: nose obstruction, stopped sensation, sinuses, right? Because she says the nose gets blocks and then she gets headache and there is a heaviness in the sinuses. I took this symptom: nose obstruction, stopped sensation, and sinuses. So the remedies here we are getting most of them, I think, except Heliactis, the eagle, and sternum. All the remedies are very new. Normally what we do, we just skip here. We don't understand which remedy to give. You can see all the remedies which are coming here is all are rare remedies. One is Betula, then is calcium, then is Heliactis, then is lava, micro something, then is Phytoleca. I don't even know this Pop XC. We have Sticta, and then we have Vanilla, we have Sternum, we have Xeno. So see, when these such remedies come, where practically you're lost, which remedy to give here, because we don't know any of these remedies, right? So next symptom which I picked up was nose, sneezing, frequent irritation in nose form. She says there is something here which she was not able to go further in the sensation. I couldn't get any sensation other than ki kuch kya hota hai, and then I start sneezing. So here we came to some remedies, which is ambra, carbovage, pyrus, teucrium, vanilla. So here I know that teucrium, carbovage for coryza, I can't think. Teucrium with this nasal irritation, obviously I thought of teucrium, it can be the remedies. But somehow what I know of teucrium is not matching with this case. It's a case where there is some irritation, there are nasal polyps, and it's a remedy for worms. Then I went to the materia medica also, but somehow I was not able to think of teucrium more. So again, I landed nowhere. So this symptom I have taken from MAC repertory: nose obstruction, sinuses. This was what I put in the this, and I got this rubric here. So this was a rubric which I took. So when I repertorized at the physical level, only the pathology thing, I came to this chart. I got carbovage, I got teucrium, I got vanilla, I got ambra, I got sticta, but I was not able to clearly pick up a remedy. I was not able to pick there was no characteristics that I could select one remedy out of this, right? So what I did, I went further with the knowledge I got from the life space, when I got something about her, who she is as a person, right? So then we add few more things, and then we are able to work out a remedy. So what I took is, I saw her industrious mania for work, household matters about. Do you all agree or not picking up, would you think of taking this rubric? Would you think of taking this rubric? You can put it in the chat box. Can we take this rubric? One is yes, one is no. See, what I saw her, she could have stayed at home and done work for 3 people. And what she is doing, she's taking care of 4 more extra people and continuously showing. You all remember that in Corona times, we didn't even have maids. So it was so difficult to work for our own family. Here, what she was doing is she was working for 2 families. She was doing the whole household chores. She was doing all the chores of the home, which the maids were doing, and she was still happy. What was there in her that which made her stay in that family? So this was a rubric which I took: mind industrious mania for work, household matters about. She was happy doing all those work, although it made her tired, but she was able to do so much work. Then this work, other rubric which I took was mind, order, desire. She wanted that order of the families, कि ये family ऐसी ही चाहिए मुझे. She had that particular order in her mind, कि joint family, then the brother, that they should be together. So this is what I saw, कि she had a particular structure in her mind, कि this family should be there, and this should, my children should be there, the doors should be happen. So this was her idea of the family, how a family operates. So first we saw that the issues were of family, that is subclass 4, as Dr. Charmi has also pointed out, that this is subclass 4. I'll be talking about something about subclass 4 and how we'll go further. And also we are doing in depth these charts. We have completed mineral. We are doing animal charts in my Evolve lecture series. Also, we'll be starting plant charts, which is by Michelle Yakir. She's from Israel and she has written a book of wondrous plant, and which is a wonderful book if you want to study plants in detail, or if you want to go for using the lesser known remedies. So mind, order, desire for. So this was the order which she had in her mind, कि ऐसी family होनी चाहिए. This is how I took that rubric: mind, order, desire for. Here we can see arsenic coming up very strongly. So again, if we added, when I added these 2 rubrics here, in my nose, sneezing irritation from, nose sneezing frequent irritation from, nose obstruction, stopped sensation sinuses, then mind, order, desire for, mind, industrious mania for work, household about. So again, what we are getting is vanilla, carbovage, arsenic, teucrium, placenta. So again, see, there are remedies which we are, other than arsenic, which we know a remedy as as a remedy for coryza and headache and this kind of things. We are getting arsenic, but still that feel is missing. As you all pointed out, she's very sensitive. As you all know that we are doing plants here. What is the energy of a plant? It is very, very sensitive. So what is her sensitivity about will give us the remedy. So we have seen that her sensitivity is about the family staying together. It is having the family for, like it's about whole energy of hers is in keeping the family together. She's very timid. We are seeing a person who is staying with her parents, with her family. She has taken her husband and the child to her parents' place and she's staying there. She's working there. She has taken up a job here. So again, we see that a person who is so dependent on a parental house also. She is taking two people with her and she's staying, she's working. Obviously, she might be receiving something from there. So we see that this is not an energy of arsenic, but still we have to filter out the remedy. Now, how do we go further? Once we come to this set of remedies, here my knowledge of remedies, which I'm studying from Yakir, is helping me to go to lesser known remedies. We are not seeing any remedy coming up clearly in spite of taking help of repertory. So this is what makes us stuck in cases. And practically what we see is allergy. It takes so much time for the allergy, and this is a field where allopathists or ENT doctors are also helpless. My brother himself, he is a ENT doctor, but he says that we practically are not able to give much hope in allergy other than allergy testing and giving some anti-allergics. That too also some relief is given, but the problem recurs. And this was the case where surprisingly one dose of the remedy helped her, that when she came to me for a follow-up after 6 weeks, because it was corona time and she was staying away, she did not require a second dose. I had loaded one dose when she came to my clinic, and I gave her a few set of doses, take it at SOS, and I gave her SL. When she came back for the follow-up after 6 weeks, she said, I have not needed this remedy. And that was also very surprising for me. How can one not need a second dose of a remedy in spite of having allergy for so long years? So, and I had only few doses of this remedy. And as you all know, in Corona time, we were not getting the access of remedy. So, what I did was, I just told her to keep this remedy with her and use it only when required, because she did not need it for 6 weeks. I thought she may not need again, but still, because of Corona time, I gave those remedies with her again. And surprisingly, when she came for the second follow up again after a month or so, she still said that I didn't require the remedy, and that was the point. I just took those remedy back for, because those were the only few doses I had. So I thought, if she's not needing this in 2 months, let me take this. So I just took that remedy back from her, because it was a rare remedy which I had only few doses. So this was the miraculous result. I can say that I didn't require a second dose. Hardly these are some like miraculous cases or bookish cases कि एक डोज दिया and दूसरे की जरूरत ही नहीं पड़ी. This is what we have read, but practically that happens only 50% of our times. We can say this doesn't happen always. So now the remedy which I gave her was vanilla. So have anybody of you used this remedy, or do you know something about this remedy? Any one of you? Because this was my first prescription of vanilla. So now, although I gave her, I have to understand why this remedy worked. Have anybody of you used this remedy? So we'll now, what these cases, such cases, yeah. So these cases which work miraculously with some remedies which even we don't have knowledge of, now this person has become a teacher of this remedy. I always now try to understand these things better, ki why vanilla worked, how a person is. So this is a time when I take it to learn more about this remedy, what the remedy is, so that next time I'm able to grasp this remedy more in my clinic. So how we study one remedy from using Michelle Yakir's book is what I'll be sharing now. So this is Michelle Yakir. Her book's name is Wondrous Plant. She's from Israel. She is a botanist, and that is why she is able to understand and connect the remedies to botany, the botanical significance or the signature remedies. So she has written a book which is very, very, I can show you this book. It's always on my table. Even if I take it home for 2 days, I call this as my Bhagavad. I have my staff, I tell them, Meri Bhagavad Gita leke aao. So this is the book. And once you start reading from the book, everything, it just falls into place. There are so many missing things. Repertory mein, when we learn a remedy, we hardly are able to grasp the whole remedy in essence. So here is a chart of period plant kingdom, which is given by Yakir. This concise plant chart is given by Dr. Gandhi also. He's also working with this method. So this is a chart where we have divided all the plant kingdoms in 6 subclasses. You can see 1, 2, 3, 4, 5, 6. So first is Magnolidae, in which we have Nux moscata, we have our lotus remedy, we have Ranunculaceae remedy, we have Pepperberries, that is opium. So that is the class 1, subclass 1 or column 1. Second is Hemamelidae, which is the cannabis family. Third is Caryophyllaceae, which is the cactus family. And I've hardly given any remedy from third subclass. I believe what I have not given is because I don't know. When I study that in detail, maybe I'll be able to come to a remedy from that chart also, that column also. But till now, I don't have any remedy from subclass 3. Subclass 4 is again Delinidae, in which we have malvales, we have thiales, we have this carnivorous plants, we have malvales, we have cyclamen, we have cucurbitales, the Bryania family, we have this viols family, and also we have salicales, the Salix nigra, the Salix family. So this is whole subclass 4. Then we have subclass 5, in which we have Enagatiaceae family. Then we have subclass 6, where we have the Solanaceae family, the Compositae family, the Gentianales, the Loganiaceae family, which is Ignatia. So we have divided our plant chart into 6 subclasses. So this is in brief, these subclasses, and then there are themes of these particular columns. Each subclass or each column has its own themes. So this is a chart and this is the themes here. You can see this chart here. This is from subclass 4 to 6. And there are 2 columns here. One is a long 2 sections. One this upper section, which I'm showing with my cursor, and one is a down thing. So again, the plants have been divided into monocots and dicots. So monocots is which has a single cotyledon, and dicots is where they have 2 cotyledons. So here you can see this chart, I have cut it, and this is subclass 4, 5, 6, and here we have the monocots above thing. So this remedy is from the monocots. I think I have taken one class on monocots. I've shared one remedy of monocots. I'm not able to get which it was, but I've taken a webinar on monocots. So we have these different characteristics of monocots and dicots also, which we can learn someday. We can do some webinar on monocots also. Avena sativa, right? Thank you. So Avena sativa also was from this subclass 4 and monocot. It is the Poales family. Poales means all the grains, the grass family and the grains. So the rice, the wheat, the oats, the sorghum, all the grains we are having, they fit into this family, which is the Poales. You can see this pink above. This purple one, this lavender, is the subclasses ka main themes. So the themes are similar to those of subclass 4 dicots and monocots. They'll have the similar themes of home, family, nurturing. This is the theme. This is the maturity, nurturing, the mother-child relationships. This is similar to row 3 of mineral kingdom, which is the natrum line. So just remember the natrum line and remember the themes of natrum line. It's about the mother-child relationship. It is about your identity at home. It is about your space in the home, your place in the home. It is about the home. It is about the feminine qualities, the cooking, the love you give to your child, the sacrifice. Someone has written sacrifice also, the way you sacrifice for your child. These themes, the harmony in the family, all these themes belong to subclass 4, which is maturity and ripeness of maternal quality, equality of male and female elements, to be nurtured yet separated, receive yet stay balanced, ability to give, to care, to nurture, to protect or its absence, being secure in the family, protective or unprotective motherhood, abandonment and separation, to have or to not have, accumulation, lack of material, digestive system, and nutrition. So when we work with this subclass, we can even see that, we have the pathology also can be seen. This pathology here mostly will be seen relating to nutrition. It is a nutrition line. We call this as nutrition line or the nutrition column. So now what we see, this is subclass 4, where it's a monocot, and the monocots and dicots, there is a different. Monocot mein there is a single cotyledon, so there is no consciousness of others. It's only me. And in dicots, it's me and you. So this is a basic difference. When we go further in the differentiation, we'll be able to understand the finer nuances of difference between the monocots and dicots. Here, these monocots, they are very childlike. They are as if they want that protection of the womb. So this is not this dicot. This monocot is like a single cotyledon in the pod. Even vanilla has a pod, and there is a single cotyledon. So there is no awareness of others. So this is like a baby inside the womb. So this is the basic, you can say, basic characteristics. What we see in this lady, that she is ready to work hard, but still she wants to be in that protective family. The family is giving her protection. So the protection, this kind of protection is more important. So this is a quality of a monocot. So in monocot, she is giving in that protected family environment. She is giving so much. So this is nurturing. That is why this is 4th subclass, monocotyledon. But what we see here is this column is extended here. After this, it's liliales. So this is orchid. First we have gramineals, the poales family, the grass family, which is in Avina Sativa webinar, I have talked about poales. So we have poales and orchidales here. And then we have liliales, which is the veratrum family, the lilium tick family, the lily family. So what we see here is, in monocots, there is no 5th column. Just try to listen, and if you listen to it again, gradually it will seep down. Then sit with the chart, because it's something very, very new. Maybe you get overwhelmed, but when you see, it becomes very easy to work out the remedies when you know this chart. There is some homework. We have to sit with the charts. We have to understand. We have to fit in the normal known remedies, and then everything starts making sense. So what we see is orchidales and liliales is there. There is nothing in between. So many a times we'll see orchidales person like vanilla. Vanilla is having a very distinctive, unique flavor. So this orchid family is unique also. So it will give you a glimpse of orchid liliales. So they'll be very, they will have some uniqueness in them. And the uniqueness is that they can care more. They can, they have the capacity to, that is their particular. What is the uniqueness of this lady is, she's able to do so much housework. just to keep this family together and give that protective environment to this family. So this is the uniqueness. She is desiring that order. Everything has to be in order in her home, be it her home or it physically or mentally, everything has to be in order. So this is the uniqueness of this family orchideals. And in vanilla, the uniqueness is that she desires that order. Everything has to be in order. So what we are seeing is, we are seeing this some that this is going towards liliales, the liliflorae family. The uniqueness is there, but still the anchor is the nurturing quality. It's making some sense or no? I just want a yes from you all. It's making sense. Are you able to grasp what I'm sharing? Right, I've got only one yes. Okay, only two. I'll go forward. Yeah. If there's any query, you can ask. This is the time you can get it clarified. And we'll be doing this chart in detail in my Evolve series. We'll be doing this charts again. You can do single lectures also. Yeah. So you can attend single lecture of plants. You can attend 2 lectures of plants also if you want. So this is how what we are seeing is orchid family. Now we have a whole book on orchid family by Louis Klein. He has written a book on miasms and he has given many new remedies of orchidales also. I think there are around 20-25 remedies from this particular orchidales. So this is subclass 4 and this is in the low, as you know, this chart has subclasses 6 and then it has 9 rows. I'll go back and show you all. These are the 9 rows. 1, 2, 3, 4, 5, 6, 7, 8, 9 lower rows. So orchidales is in the lower rows of lower rows. In monocots, these rows are not well defined. In dicots, these rows are very well defined. This is again the difference between monocots and dicots, as we have differences in invertebrates and vertebrates. In invertebrates, there is no clear demarcation, but vertebrates are more evolved, so we have clear demarcation. Here also in monocots and dicots, it's the same thing. Monocots are not that evolved, so they don't have clear-cut boundaries. So here we see that just the lower 3 rows are orchidales. So in subclass 4, these are the lower rows. Like in dicots, we have cucurbitales and saricales and salicales and caprales. So similarly, orchidales is the lower rows of monocot subclass 4. It means they are adults in that thing. Adults. They are adults in that subclass. So here we have row 6, row 7, row 8. In subclass 4 is whole family of orchidales. So just by knowing this location of orchidales in the map, now you know what it is all about. We'll try to match with the characteristics of the chart with our patient. So row 6 is adolescence, row 7 is young adult, row is mature adult, maturity. So what we are seeing in our patient is, we are seeing all the characteristics of a young adult. She is entering the adult life. She is trying to be independent. That's why she is working also. She has a desire for advancement. She has desire for a social achievement, money and enjoyment. She says it's a family. Vacation is a time to enjoy. People, they have this security. They have this background in the family. They have in vacations, we can go there. They can come to us. Kids stay together. They enjoy. So this is, extending beyond your family, expanding your family, because it's the extended family, it's a joint family, it's enjoying, it's about forming relationships, it's about intimacy. So here they are trying to form relationships within the family. They have not gone outside. They have not stepped outside. This is what you have to see. Oh, look, they can stay at their home and they can have family, they can have friends, but she doesn't want friends. She wants the security in the family, like this vanilla pod. Vanilla has a pod. So, forming intimately caring relationships with others, but in the family. This is what you have to remember. So, she is very adult like in this family order. She wants that order in the family. So, this is adult in the family. She's giving so much. On one end, she's like a child, this, but there she is a mature adult. So, this is the kind of dynamics which is going on. Here, it's sexuality replacing the intimacy. So here, when one person, they are not able to get intimate, there is a block in intimacy, they will replace it by sexuality. That is why we see these colors are so attractive. And these flowers are pollinated by insects. So there is a very close connection with the insects over here. They are very colorful, they'll be very attractive. Sometimes they'll have that kind of energy. And also what we see here is they are very busy like a bee, because they are pollinated by insects. See, this is what a botanist view about the homeopathic remedies. So Dr. Michelle Yakir, she's a botanist. She understands all these aspects. So how the plant is being pollinated also gives some flavor to the remedy. So this remedy is busy like a bee. She always wants to work, 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 work. This is like the insect energy, because there is a close relation with that pollination. So this is a remedy which is, the bees are the vectors here. So that is why we can see the energy of a bee, like a bee. And also, this is the maturity, creativity, doing, acting, taking on responsibility, stepping out of the family towards the world. So this is her first step of going away from her maternal family, the in-laws. But again, it's a family. ये दोनों भाई तो एक साथ रहते हैं ना. They are so happy together. So this is her first step to go into the world. But still, the anchor is a maternal home. You can see this dynamics, this interplay, this movement. Separation from her family to the families of in-laws. She's still anchored there. This is the fourth subclass, monocot. उसको अपना base चाहिए. She wants that family, but she's still trying to move here because she's an adult now. So this transition, this energy, you can feel it in your cases. Concern for others, sympathy versus apathy. So this is fertility in life versus stagnation or inability to have one's life fruit or bear fruit. This is what, as we go down towards an adulthood, we introspect कि हमने लाइफ में क्या पाया, क्या खोया, what we have achieved. So this is the introspection time. So these 6, 7, 8, this whole spectrum is orchidaceae. Although in our patient, what we see the young adult. We are seeing the phase of young adult, but orchidaceae, it's a big order. There are around 25 to 30 remedies minimum which have been added by Lewis Clean. So whole spectrum is covered here. So some different remedy may point out toward adolescence, some different remedy of orchideals can show us this maturity, but in our case, what we are seeing is the young adult. She's wanting to expand her family boundaries. She's starting to take the responsibilities. This part, entering adult life, partaking in life as if an independent being, desire for advancement. She's trying to form intimate relationships and caring relationships with others. So this is Vanilla planifolia. This remedy elicits particular to family and home versus the personal. Dependency on mother, grandmother, on the children and the husband. Please pardon these spelling mistakes because I've just completed this typing from Yakir's book. The family is experienced as protected and nurturing place. So this family is experienced as this because it's like a monocot. It's needing a womb. It's needing a protective environment. And these vanilla patients, they are very much affected by death of a close person, as well as separation from, they just fall apart. This is the dynamics here. So ailment from death of loved one, much importance is placed on the family. They require support and constant presence of a mother, or they can be born into a supportive family, and they have a trouble when there is a time to separate from this problem. We are seeing that this person is still not able to separate from a maternal family. She is just taking steps, and that is what it shows, that she is going into the adult zone. So they have a desire to be carried. They want that support. She still wants support from a parental family. She's staying with her parents. It could be children who need to be in their mother's arms all the time and cannot seem to part from her. So these, if they are children, they will see that there's a desire to be carried. And how we see the desires to be carried in this person is she's still staying with her parents. So all this is subclass 4. This is vanilla, this is the plant, and see, you can see this creeper kind. It is creeping on something. So they need this support. They cling to this support. This is the clinging. These are the vanilla plots. They cling to some parent figure. And also what we see, these are the vanilla pods. The tiny embryonic seeds are lacking endosperm, which means they don't have their own store of nutrients. To nourish the embryo during generation, and therefore they cannot sprout without the aid of symbiotic fungi. They don't have the endosperm, the monocotyledon, the endosperm here itself, they don't have, they are lacking the nutrition. So this nutrition they take from others, this nutrition is a symbiotic relationships, and that is why they live by symbiosis. So what is she doing to her assistant dog? She's taking some nourishment and she's giving some nourishment. She's staying there. She's having that protective environment of the family in her in-laws place, the sister-in-law's place, and she's serving there. So this is a symbiotic relationship, because this plant needs fungi so that they can sprout. So this is the symbiosis, and this is kind of parasitic relationship also, you can see, or symbiotic relation. There is a give and take over here. So this is how we are seeing it from doctrine of signature also, and also from the subclasses. So you can just start sharing what you have learned from this introduction of orchidaceae. This is just a gist, this is just a small seed. You have to water it, you have to learn from all the sources. I'm just giving you all seeds. It is upon you all how to germinate these seeds. This is what I'm learning now, and I'm just sharing these seeds. So any doubts? Now you will see all the symptoms of vanilla, how everything will fit in, why she wants order, or why she wants that kind of support, why she's so family oriented. Any doubts? See, this is vanilla. Rubrics I've taken from complete repertory. All the rubrics, there are anticipation ailments from aggravation, anxiety, household matters about, anxiety future about, anxiety time is set when. Now why? Because there is need for order. So she has a problem, anxiety, when the time is set. Bathing, washing, desire for. Business incapacity for, colors desire for, because it's a very bright color, right? This will seem like a insecta, desire for colors, but you know now why this color desire for there is in orchids. Orchids are very colorful plants. So these are the rubrics. Delusions, pregnant she is. Delusion, thin she is. She's very dictatorial. Dissociation from the environment. So now when we study these rubrics, we'll be able to make some sense out of it. Very sentimental. Sadness alternating with energy, physical. Time, loss of conception of. Time passes too quickly, appearing shorter. Tranquility, desires. Very sentimental. Mistakes makes in perception, mistakes makes in locality. There is hurry, haste, flower desires and flower. And here we have this rubric, finery, luxurious clothing, desires. Finery, luxurious clothing, wants, shoes. You know, because I told you all that there is now, this is anchor is subclass 4, but it is going towards liliaceae. So that's why there is a need for luxury. That this will give you some, if you don't understand orchids, you may prescribe the remedy from lily flore to this person. Maybe lilium tag or remedies from this family, Sabadilla, because they want to flaunt. Now they want to be in the society, and because of this insect pollination, the energy of an insect, they may seem like an insect remedy also. So any queries, or we'll sign off? Nothing to share? Okay, understood or not? The remedy, are you happy with the remedy or not? Aparna, Dr. Kanchan. Yeah, Dr. Manisha, you will be able to understand. Yeah, a little overwhelming. I can absolutely understand this overwhelming thing, but this we are learning new things. We are learning new plant charts. I'm yet to take lectures on the plant charts. So it's a new work of, it's a magnanimous work by Yakir. You know, she has, this book is just flowering plants, first part. Another book is coming on non-flowering plants. That will be the ancient plants and non-flowering plants. So just very difficult. I'm lost. You can just ask some questions. We'll be doing plant kingdom charts. So Aparna, I think we'll be able to review this again webinar. I'm just introducing these concepts because I think last few are remaining, so I have to introduce these concepts. There is lots and lots and lots of to learn, and it's very interesting. Once you go through this, it becomes very easy to understand these. At least you know where we are in the chart. Otherwise, we would have never been able to solve this case. This was just one dose of vanilla. I literally snatched the remedy back, but वापस दे दो because it's Corona time. I may not get the remedies. So I just, after the second follow-up, I just took the remedies back. I have those few pills with me. So this is a new remedy. You can study the rubrics also. When is the plant chart? I think after one lecture, Dr. Kanchan, I'll be doing animal. It'll be around next month. So I'll just share. So next, I think we have done this animal chart lecture 10. the animal chart invertebrates. Lecture 11 will be animal chart vertebrates. After that, we'll be doing plant subclasses. So lecture 12 will be about these 6 subclasses, and lecture 13 will be doing the rows. We won't be doing monocots, we'll do only dicots this time. We'll do monocots in our advanced series. So please join us for these Evolve series if you want to learn more about this. And Dr. Aparna will be doing this shortly, so you'll be more clear. You can go through the webinar of Evina sativa, which we have done poils from the same subclass for monocots. But poils will be a bit more above. They'll be from, like, rice is the womb stage of monocots. So we have done that in brief. We'll be doing it again in our advanced lectures. The monocots, we'll be doing dicots, plant classes after one lecture. So this is trying to make a system out of symptoms, because sometimes the symptoms are not very, we don't understand those symptoms. We don't have those peculiar modalities because some of the remedies are not proved to that level. They are not proved to that level to be, so that we get the finer nuances. Maybe we start proving new and new remedies, we'll get the finer modalities. So thank you so much for being here. Thank you so much for adding more to my knowledge by sharing, because sharing is again a new way of learning. Let's be open to learn new and new remedies, new methods. It's fun. And especially when we work out these cases with single remedies, such deep cases with single doses, we understand the importance of learning new remedies in simpler ways. So thank you for being there. So we'll meet after 15 days, next to next Tuesdays. Thank you.